טוב, ערב טוב לכולם. ברוכים הבאים להרצאה הרביעית והאחרונה שלנו בסדרה על פגיעה מינית בבנים ובגברים. אני אפתח בכמה מילות פתיחה באנגלית, אחזור חזרה לעברית, ואז אציג את דוקטור גרטנר. לי קוראים אורי פריד, אני עובד סוציאלי קליני וחבר ועדת הביקורת באיפ"ם. I'm excited and honored to have with us today Dr. Richard Gartner for our final and concluding lecture of the series of lectures regarding the sexual abuse of boys and men at HIPAM, the Israeli Healthcare Association for Sexual Trauma, Prevention and Treatment. I find having Richard giving a lecture to the Israeli audience is of acute significance, as Dr. Gartner has vast knowledge and experience in treating boys and men survivors of sexual abuse. In my clinical work with men survivors, I have found Richard's insights both very helpful in mentalizing different dynamics that unfold in the room, and also very comforting, knowing I am not there on my own. It has actually been a dream of mine to have you with us here in Israel, Dr. Gartner, to help promote the voicing of so many boys and men whose voice is seldom heard in the realm of sexual trauma. Thank you, Dr. Gartner, for making the time and being here with us today. I will start with a few announcements in Hebrew, and then I will turn back to English and introduce you, Dr. Gartner, and we'll continue on with your lecture. Okay? אני מתרגש מאוד שאנחנו פעם מארחים היום את דוקטור ריצ'רד גרטנר, שהוא אחד המומחים הגדולים בתחום של טיפול בבנים ובגברים נפגעי תקיפה מינית, להרצאה האחרונה והמסכמת של הסדרה הנוכחית שלנו, אודות פגיעה מינית בבנים ובגברים. תודה שהצטרפתם אלינו. אני רוצה להודות לוועדה המארגנת של סדרת הרצאות זו, לדוקטור מולי לינדר, לאוס מירב לברון, לדוקטור שמואל הירשמן, וכמובן לדוקטור ענבל חרמוני, יושבת ראש איפ"ם. כמו כן אני רוצה להודות לשאר חברות ועד איפ"ם, לדוקטור אנה פדובה, לאוס טניה אורן, לדוקטור ג'וליה ברדה, לאוס יפעת בן דוד ולדוקטור דפנה ארמון. אני רוצה להזכיר לכולכם שההרצאה היום מצולמת, ושלאחר סיום הסדרה ועריכת הוידאו, ההרצאות שצולמו יישלחו לנרשמי הסדרה. כמו כן, לאחר ההרצאות יישלחו 2 פרקים מספרו של דוקטור גרטנר, אשר עוסקים בדיסוציאציה ודפוסי העברה בטיפול בבנים ובגברים נפגעים, כמו שהיו בקשות בהרצאות קודמות בסדרה. אני רוצה להזכיר לכולם שוב שביום ה-11 לשני, בעוד כ3 שבועות, תתקיים אספת החברים השנתית של היפ"ם, שבה היפ"ם מזמינה את כל מי שירצה להצטרף אלינו ולקדם נושאים בתחום שחשובים בעיניו, להגיע ולהירשם בטבלה שנמצאת בקבוצת הפייסבוק של היפ"ם, שנמצאים בה כל הנושאים שעליהם נדון באספת החברים. אז אתם מוזמנים להיכנס לעמוד, להתרשם ולהירשם אם אתם מוצאים נושאים שמעניינים אתכם. בחזרה להרצאה של דוקטור גרטנר, הרצאתו של דוקטור גרטנר תינתן באנגלית ותארך כשעה, ולאחריה יתאפשר לנו סשן קצר של שאלות ותשובות. את השאלות אנא תשלחו אליי בצ'אט הפרטי, בעברית או באנגלית, ואנחנו נעלה אותן בסיום בפני ריצ'רד. במהלך ההרצאה יתייחס דוקטור גרטנר ל2 שקפים אשר נשלחו לכל הנרשמים במייל ביום ראשון האחרון, אתם מוזמנים להכין אותם בהישג יד. אני אחזור עכשיו חזרה לאנגלית. Dr. Gartner, we're going back to English and we'll be with you in a second. So I would like to introduce Dr. Richard Gartner, who is a psychologist and a psychoanalyst, a training and supervising analyst and faculty of the William Allenson White Psychoanalytic Institute in New York. Richard is the founding director of the White Institute's Sexual Abuse Service. He was a co-founder in 1994 of Male Survivor, the American National Organization Against Male Sexual Victimization. Dr. Gartner is the author and editor of many books on the subject of sexual abuse of boys and men. The titles of the books you can see on the screen just beside me right now. Amongst all the many books that Richard has written and edited, Betrayed as Boys, Psychodynamic Treatment of Sexually Abused Men, Beyond Betrayal, Taking Charge of Your Life After Boyhood Sexual Abuse, and many others. Richard asked to point out that all his books are available also on Amazon for the Israeli reader. So if you find interest in the lecture today, you're more than welcome to look them up online. The topic of Dr. Gartner's lecture today is the sexual betrayal of boys and men. Richard's lecture will last an hour long, and at the end, we'll have a short Q&A session. Thank you again, Dr. Gartner, for being here with us today.
Okay. Well, I want to thank you for inviting me, Ori, and well, I've lost you. What happened? I was just, Ori, I'm viewing your screen. I need to view mine.
You're probably seeing the Zoom screen now. If you just shrink the Zoom screen, you'll see your screen on your laptop.
Okay, sorry for that.
And if you can just raise your voice a little bit, that'll be...
Okay, and I have invited Ori to interrupt me if that is necessary from here on in. So I want to thank the ISTT for organizing this conference and for inviting me to speak to you, my Israeli colleagues, about a topic that has been hidden for too long. While my talk is called The Sexual Betrayal of Boys and Men, I have a subtopic, which is how masculine gender socialization interferes with healing for sexually traumatized men and boys. I won't only talk about that, but that's something I'm going to try to emphasize. So I won't go into the whole history of how society has, for a long time, not recognized sexual abuse of men and boys, and then just begun to recognize the trauma of sexual victimization for men. When I first began working with this population in the 1980s, virtually nothing was written about it. All through the 90s, when I would make presentations like this, I could see on people's faces and in their questions that they really didn't believe much of what I was saying. It was not really in the public discourse at all. That changed in 2002, when the scandals in the Catholic Church began to emerge, and it was very difficult at that point to make believe it was not happening to anyone. So I'm speaking from my experience in the US, but having treated or evaluated men from 6 continents, many cultures, including Israel and most of the other countries in your region, I believe that male sexual victimization is universal in all societies, whether it's spoken about or not. Research in the US suggests that 1 in 6 men have been sexually abused with direct or penetrating contact. When indirect abuse, such as exposing oneself to a child, is added in, the number is 1 in 4. Of these, 60% of those men were abused by men, 29% by women, and 11% by both male and female abusers, which is a number that I think surprises some in terms of the male and female abusers. I doubt that the numbers are very different in countries where the sexual victimization of boys and men remains a secret and forbidden topic. So 1 in 6, That's about the same as, at least in the US, the number of men who in their lifetimes will develop prostate cancer, which is not an epidemic, but it's very, very, it's a great number, and it's considered a great number, and the public knows about it. But the 1 in 6 men who were sexually abused as boys are not listened to. And the figures for men are likely to be underreported. There's difficulty in doing research. It depends on what you ask, which gets us to the issue of masculine gender socialization, which, as I said, I'm going to focus on today. But about the research, if you ask a man if he's been sexually abused, he's likely to say no. But if you ask about specific things that might have happened to him, then he'll tell you about his life. Men don't want to think of themselves as having been abused. So who are the abusers? At least in the US, usually it's thought of as something by a stranger, some sort of predator who is not known to the boy or to his family. And this is not true, by and large.
Richard, I'll just ask you if you can raise your voice a little bit.
Okay, thank you.
Or even better, if you can just put the microphone closer to you.
It's in the computer. I can't do a thing with it.
Okay.
I can try to move the computer closer to me. So who are the abusers? In my practice, they have included fathers, mothers, brothers, sisters, female and male babysitters, grandfathers, grandmothers, teachers, family friends, and neighbors, friends of older siblings and older siblings of friends, camp counselors, a family doctor, a godfather, a priest, a nun, a minister, several rabbis, and the director of a summer camp. Virtually none of these men that I've worked with was abused only by strangers. And if you notice, all of these abusers are in positions of power and trust, which has implications for future relationships. And this brings me to the interpersonal trauma of abuse. All of my books but one have the word betrayal in the title. That is not an accident, because I am an interpersonal psychoanalyst, and I think of sexual abuse as an interpersonal experience, which is defined as betrayal. So what happens in betrayal? It changes the frame of reference for interpersonal relationships. It's a violation of implicit or explicit trust. Seemingly unbreakable bonds are broken, and treachery is introduced into the most private, personal, and trusting relationships. The betrayed individual is jagged, awry, fractured, recklessly hurt. So this is an interpersonal trauma. And a person who sexually betrays a child is an exploiter who uses a power relationship to satisfy his or her own needs without regard to the needs of the person being abused. Trauma, as opposed to betrayal or abuse, trauma is the effect on the victim. Trauma is a reaction to an overwhelming life experience. Traumatic events are unexpected, unusual, often coming without warning, and they exceed a person's capacity to deal with these events. And it seriously disrupts psychological stability and frame of reference. Now, sexual betrayal may have been positively framed, disguised as education, love, mutuality, hygiene, medicine, recreation, making a child into a surrogate spouse, payment of a debt owed the adult, or a fair trade for something the adult did for the child. And when abuse is orchestrated as a loving, caring, or playful act while the abuser is grooming the child is betrayed not only by the abusive behavior itself, but also by the lies, mystification, and confusion surrounding it. He may learn to equate abuse with love or care or play or nurturance. So grooming behaviors are designed to secure compliance and silence from the victim and his family. It's a predator's unique skill and weapon. Victimizers' demeanor, generosity in the community, and rapport with children all add to their ability to convince others that they're normal and have no deviant interests, and it ensures that it's unthinkable to consider such individuals potential child molesters. And in grooming, normal behaviors, however we define that, slowly becomes increasingly seductive and sexualized behaviors and demands. And if it's done well, it decreases the likelihood of disclosure by the victim and increases the likelihood of ongoing, repeated access. Sometimes people ask, well, maybe this child wanted this to happen. Sometimes men say, I wanted it to happen. But are children capable of understanding implications of sexual behavior with a trusted caretaker or any adult? I think not. Now, one reaction to this kind of trauma is dissociation. And I heard that some people were interested in hearing about it, so I'm going to talk a little bit about it. Dissociation happens in adults who are high functioning, but with areas of dysfunction. First, there's ordinary, everyday dissociation, like driving on a highway. We all do that. If you drive on a highway and you suddenly notice that the 10 exits have gone by since you last noticed where you are. That's dissociation. Then there's adaptive dissociation, such as escaping a burning building or floating up to the ceiling in your mind during the abuse. But then there's pathological dissociation. That happens if the adaptive dissociation becomes habitual and becomes the defense that they go to most often when they're anxious and it's not necessary. So dissociation is the severing of ties between mental contents before they enter awareness. By mental contents, I mean affect, behavior, knowledge of facts, and sensation. In dissociation, it's kind of a self-induced hypnotic state to protect the victim from disorientation and pain. It shuts down the information processing system. It keeps experiences pre-symbolized. And it emerges in disguised forms. Since it's never been put into language, it emerges in disguised forms like in enactments or images or somatic sensations or anxiety states or psychosomatic conditions. It allows the child to encapsulate the trauma and function relatively well in other places. But when dissociated material emerges, which can be decades later, it is the same terrifying, unsymbolized form it was in at the time that it was put into this dissociated place, since it was never processed or symbolized in language. And that's how you develop general dissociative patterns. Dissociation soothes pain. In particular, addictive and compulsive behaviors are soothing. Workaholism, food compulsions, anorexia, bulimia, compulsive working out, shopping, gambling, getting into debt, and especially abuse of alcohol and drug addiction, which chemically induce the same kind of hypnotic state. And equally common, of course, are sexual and pornography compulsions, or often called sexual addictions. Just a brief example of how a man looks when he is clearly dissociated. And I should say that any examples I give, I have written about and I have permission to speak about. One man I worked with some time ago was phobic about sex based on his sexual abuse. And the only way he could have sex with his wife was by first smoking marijuana and then dissociating, so that he was never really aware of what was going on. She didn't know that. That's how he saved himself from having the trauma, the original trauma, come back to him. So the first slide, please, Ori. There are three ideas I would like you to take away today about male sexual victimization. One is masculine gender socialization. Two is feelings about homosexuality. And three is fears of becoming an abuser. Next slide, please, Ori. So the first concept is masculine gender socialization. How boys and men encode abuse. I guess you can see me as well as the slides now. Okay, good. You have a couple of these in the handouts I gave to you, if you can follow along with them, or they're on the screen. But you can come back to them in your handouts. Sexually abused men often say the behavior was not traumatic. However, these same men are more likely than non-abused men to enter psychotherapy for reasons that seem unrelated to abuse. And this is because of masculine gender socialization, which for many men leads to what we may call the masculine masquerade, or sometimes as hypermasculinity or toxic masculinity. Through masculine gender socialization, boys are told one way or another, be a man. What does this mean? Next slide, please. Cultural beliefs about men. Here are some of the conscious and unconscious cultural beliefs about what real men, masculine men, are supposed to be. Men are always in charge of themselves, in control. Men are competitive. Men are competent and powerful. Men are mentally and physically tough. Men are resilient. Men are independent rather than needy. Men don't express emotions, like big boys don't cry. Men are alexithymic, that is, unable to put emotions into words. Men welcome sexuality whenever it is offered, particularly from women. And finally, men must not be penetrated, violated, subdued, or otherwise forced into submission. So these are all the beliefs that, at least in Western society, and certainly in the US, we all grow up getting this in ways we don't usually even know about. It can be said like big boys don't cry, any parent can say that to a child, but all of the others are communicated in subtler ways often enough. Now, infant research suggests that socially constructed masculine ideals culminate in an ordeal of emotional socialization through which boys, who actually start out life more emotional than girls, learn to tune out, stifle, and channel their emotions. And through conforming to the ideal of not expressing emotion, men become strangers to their own emotional lives. They frequently channel their vulnerable emotions into anger and their caring emotions into sexuality. Now, some homophobic straight men believe that only homosexual men express emotion, and so they develop a stoic persona to confirm their heterosexual masculinity. Running through these perceptions of masculine gender identity are the usually unconscious views of masculinity as a good substance and femininity as a lack of that substance. So being manly is good, being feminine is not good for men. And if a man perceives himself as unmasculine or feminine, he sees himself as lacking an important and necessary positive element in his nature. Even men who rationally believe that these values are artificial and damaging are nevertheless influenced by them, often enduring unconscious negative reactions if they feel they have not upheld them. These ideals are devastating to all men, many of whom, and perhaps all of whom, long to be free of socially constructed male-gendered identity. And next slide, please. These slides are cartoons. And they may be a little distorted on your screens, but this is a caveman looking at TV. And it says, warning, this program contains language. The joke is men don't use language. Next cartoon, please. Okay, here we have a stereotypic Freudian analyst sitting in his chair. There's a man on the couch weeping, and he says, crying is okay, just be sure no one knows about it. And okay, next cartoon, please. Here we have a young boy, perhaps 10 years old, lying in bed with a young woman, maybe 17, 18. She looks like a dumb blonde. And he looks quite sophisticated as he smokes there. And he says, I want you to know, Marlene, I think Marlene is the name. That's from another cartoon. Anyway, I want you to know you will always be more than just another babysitter to me. So the joke there is he's the younger one, but he's letting her down gently. He is the one getting rid of her in the relationship, whereas it's more likely that, certainly men would do that to a woman. But if you turn it around, you get the next cartoon, please. This is the same cartoon, but it's a young girl of about 10 or 11 and a young man of, say, 18. And he's saying, I want you to know, Paul, that you'll always be more than just another babysitter to me. Now that gives most people the creeps. You wouldn't say that a young girl can be in charge of sexuality the way in the earlier version of this cartoon. The joke is that this young man is in charge of it, even though he's a child, and he's talking to a woman who has basically abused him. Next slide, please. So these are myths. The masculine gender socialization creates myths about male sexual victimization. One, men cannot be sexually abused. Women do not abuse sexually. Sexual abuse is always overt. Only sissies and weaklings allow abuse. Children should be able to say no to abuse if violence is not used, and if they don't, they must have wanted the abuse to occur. If a boy feels sexual arousal, he is an equal participant in the abuse. This is a very dangerous one. I'll get back to that. Male victimizers who molest boys consider themselves homosexual and are interested sexually in other men. In fact, almost all pedophiles identify as straight and say they were only interested in women. Next, victimizers are always conscious of the abuse they are committing. Actually, they're often in dissociated states themselves. And the last two, I'll be talking more about. One is sexual abuse turns a boy gay, and then that sexually abused boys almost inevitably grow up to be sexually abusive men. Okay, you can close the slide now. And these myths are supported in popular culture in many movies. I won't go through them all. I've written about them. So you get support from the popular culture, from TV, from movies, from the boys in the schoolyard, from your parents, whatever. These masculine gender stereotypes are basically anti-woman and anti-gay. They express the horror a man is supposed to have about being receptive or capable of being penetrated. And so masculine identity is at stake in being identified as a victim because victimhood is identified with being female. Remember, even men who rationally believe these beliefs are damaging may feel bad about themselves if they don't live up to them. And I imagine that in some sense that is true of every man in the room, including me. We don't always know what is influencing our behavior and our belief system about ourselves. Barack Obama said in 2019, all of us have to recognize that being a man is first and foremost being a good human. That means being responsible, working hard, being kind, respectful, and compassionate. The notion that somehow defining yourself as a man is dependent on, are you able to put someone else down, able to dominate, that is an old view. Well, would that were true, but I'm glad that he said it, and he said it in a very public place. Often, treatment needs to question socialized gender norms. Question whether it really means he wasn't a man because this happened to him when he was 6. And there's a counterphobic reaction to feeling from some men. There's a counterphobic reaction to feeling feminized by abuse. And they become aggressive or hypermasculine. And if they thus become action-oriented rather than self-reflective, they are more likely to become abusive themselves. Now, interestingly, a mitigating factor for a bad outcome of sexual abuse, a bad outcome meaning becoming aggressive, a rapist, a sexual abuser, is the presence in the boy's childhood of a confidant, someone he can talk to about things. It doesn't have to be someone that he ever talks to about the abuse. And this is usually an adult, usually a male, but that's not necessary. As long as there's someone that he can talk to about what's going on in his heart. And I believe that the reason for that is that talking to someone, even if you're not talking about abuse, teaches a boy to talk about emotions and therefore become more self-reflective. So boys often encode abuse this way. To believe he is male, he must transform sexual victimization into something he sought out and over which he therefore had mastery. So it was not truly victimization. It instead may be encoded as a sexual initiation, especially if the abuser is not a parent and is the same gender as the boy's eventual primary object choice, meaning for boys who are on their way to being straight, the abuser is female. For boys who are on their way to being gay, the abuser is male. Those boys are likely to think of it as a sexual initiation, especially as they look back in childhood. Now I'm going to try to keep this brief because I know we have not that much time here. I once got a call from a young woman who had been sexually abused by her brother. She was in treatment for that. And she had, after several years, she had decided she wanted to confront her brother about what happened. He was coming from out of town, from a rather distant place. And she wanted to know if I'd be willing to speak to him if he needed to speak to somebody after this confrontation. So I said, yes, that was a pretty interesting idea. So the young man came in. He was about 30. I never met her, so I don't know quite how old she was. Oh, yes, I do, because he told me there was a 3-year difference. He was shocked. He did not remember the incident that she was referring to, which was that he used to tickle her and become more and more aggressive about it, and tickling her where her breasts are, or would be, under her arms, and in her genitals, perhaps, and her rear end, all of these places. She would say, no, stop. And he just thought this was fun and continued. He had no memory of this. It had happened more than once, so she said. He did not disagree. He believed her, but he didn't remember it. And as we talked about it, he said, she thinks that I must have been sexually abused also, but I wasn't. But a couple of minutes later, he told me about a babysitter they had had, a female babysitter, when he was about 10, who had invited him to touch her breasts under her sweater. A very attractive girl, he remembered in retrospect. And he laughed. He said, "Boy, I was so dumb that I told my parents to stop using her as a babysitter." So I stopped him and I said, "Why was that dumb? Why was that stupid?" And he looked at me as though I were crazy and said, "Because it's nice to talk, to feel a girl's breasts, and I sure wish it would happen to me now." He couldn't tell the difference between, and I told him that he couldn't tell the difference between a man of 30 thinking about touching a 17-year-old's breasts and a boy of 10 thinking, being asked the same thing. And I said to him, "Well, you acted as though you were being abused. You told your parents not to hire her again. You protected yourself." And he was really quite shocked and thoughtful about this. The point I'm making about this brother and sister is that they were both sexually abused. The difference is she knew it and he did not. And it took quite a bit of talking from me to make him see the things a little bit different. Now, things are viewed very differently when the abuser is female, especially if she's considered attractive and is not the boy's mother. Next slide, please. This is a People magazine cover of a woman named Mary Kayla Tourneau, who was quite notorious. This was a very notorious case. She was a 6th grade teacher. She was married. She had children. And she had had sex with her 6th grade student, a boy. And he had also been her 2nd grade student, although there was no sex in that situation. And she was tried, and she was given, I believe, a very relatively brief prison sentence. And she came out, she got parole, but parole had 3 conditions. She couldn't see the boy, she had to take her medication for bipolar, and she had to attend a program for sexual abusers. Well, within 2 weeks, she had broken all of those, and she was found in I'm sorry, what I didn't say the first time, this is the point of the story, is that she was pregnant the first time. She was pregnant when she was tried, and that baby was given over to the boy's mother to take care of. The second time, they were found in a car. They seemed like they were about to leave the state or perhaps the country, and she was pregnant again. Now, she was allowed to be freed after only 7 months of prison time. I don't think a 35-year-old man who had sex with his female 6th grade student would be given such a brief time in prison. Society thinks of it as different. They think women don't abuse, but they do. And even many men say there was no trauma. And I have to assume that sometimes there is no trauma. But the problem is, you can never tell ahead of time whether any particular child will be traumatized or not. And the last person whose judgment I would trust on this is the adult who desires that child. That adult will always say, if he's caught or she is caught, well, he wanted it. This was love. Next slide, please. This is concept 2, about concerns about same-sex, about sexual orientation concerns. Now, when I'm talking about straight and gay here in this section, I am using a binary, so everybody is only gay or only sex. I do that for the sake of simplicity, but I believe that it's much more complicated and complex than that. Still, that's what I'm going to do because it's too cumbersome otherwise. The conventional wisdom, as we mentioned before, is that premature sexual activity with a man turns a boy gay. But the research and even the theorists believe that sexual orientation is nearly always determined for reasons other than premature sexual activity. And there's no reason to believe that sexual abuse alone fundamentally changes or shapes orientation, whether orientation is defined as predominant fantasy or behavior or just a self-definition. So I don't think that it happens that it turns a boy gay, but what it does do, it undermines a boy's sense of his gender identity and orientation, whether he is gay or straight. He worries about why he was chosen as a victim. Is it an indication that he's homosexual? This is for boys who are growing up to be straight. He asks, why was I chosen by a man as a sexual target? Does he know something I don't know about myself? Remember the myth that arousal means consent, so that if a boy becomes erect, that's a key, a clue people believe that he is aroused and therefore is a full participant in the abuse. This is especially confusing if the abuser is of the opposite sex from the boy's own object choice. So if it happens to a straight, I'll just call him a straight boy, he gets very confused if he gets an erection or ejaculates after being abused by a man. And the man is likely to say, see, you liked it. And he knows that there was pleasure. There's physical pleasure when you have an orgasm, of course. And the reverse is true for a gay boy who is abused by a woman but becomes aroused in some way by her abuse. Now, predominantly gay men may feel that they were prematurely hurried into defining themselves as gay, so that a 9-year-old, say, who is abused by a man and who is told he liked it because he had an erection, gets rushed into thinking of himself as gay, gets rushed into being sexual. Now that's true for the straight boys as well. Gets rushed into being sexual, which means he's been robbed of part of his childhood, a significant part of his childhood. Now, any boy is likely to ask, was I chosen because I seemed interested? Or maybe, was I interested and I didn't even know it? Did he know I wasn't man enough to resist? Did my femininity or my sissiness, my soft side, show enough to attract his attention? The specific worries for boys who are growing up gay are, did I ask for it? Was my interest in men so obvious? Did I really want it? If I found it exciting, does that mean it wasn't a molestation? And finally, is this why I'm gay? Now, I think most gay boys at some point, and this may be a little bit different now, for at least in some societies where homosexuality is more accepted. But I think basically most gay boys try at some point to find out why they're gay. And abuse is a convenient thing to hang it on. They don't have to think it through very much, because that happened to me, therefore I'm gay, and therefore I'm not going to feel good about being gay because look how I got there. And even if there's no obvious trauma, gay boys learn that gay relationships are illicit, they're secret, they're illegal, that they involve exploitation and they have power dynamics. And this has ramifications for their relationships with other men throughout life. Next slide, please. This is the fear of becoming an abuser. There is a myth that men inevitably become abusers. It's a very predominant myth and a very dangerous one. Perhaps 40% of convicted predators claim to have been abused. However, some studies have been done with lie detectors, because this was done with predators who are incarcerated, that men lied about having been abused, perhaps to get psychological help or something in prison. In fact, about 1 in 10 become abusers. This is from a study in the UK. But the fear that they will become abusive, even if they have no fantasies about abusing children, is paralyzing. It makes them, in some cases, it makes them stay away from children altogether, not want to have children of their own. And of course, there's also that myth that male perpetrators are gay. And I said before that they don't self-identify as gay, at least in research. I was on a dissertation committee, and one of the things in this dissertation by a man named Rick Azzaro is he asked sexually abused men, what would you tell a boy if you could about abuse? And these are the things they said. You are not alone. There is nothing wrong with you. It wasn't your fault. You should talk to someone you trust, and things can get better. And when they were asked what therapists should know based on their own experiences in therapy, they said the barriers to seeking treatment are the compounded isolation experienced as a result of the abuse, the shame, and cultural gender expectations that men don't express their feelings and seek help. They said, sometimes they said they found professionals were judgmental or did not take the time or interest to understand the abuse experience, or basically didn't ask much about it. I've known many men who said that they basically said what had happened to them, and the therapist had said, and maybe said something kind of non-committal, but didn't ask them to go into what happened or how it affected them. And so they learned from that the therapists don't want to hear about it, or certainly that this therapist doesn't want to hear about it. They also ask that therapists recognize that much of what goes on in therapy for a sexually abused man, which is admitting the need for and requesting help, reliance on others, recognizing and expressing feelings, these have to do with notions of masculinity. One man said, I literally did not have the words to express what I was feeling, what I was thinking. And so it took time in therapy. So those are the three concepts I wanted you to come away with. I actually have cut this whole presentation down from a day-long presentation to an hour. So I wasn't sure how long it was going to take. So I'm going to go a little bit further if I can. Next slide, please. Relational after effects. The relational consequences of sexual betrayal it doesn't fundamentally influence the direction or predominating orientation, sexual orientation, but it does influence relatedness, sexual and otherwise. In terms of general relatedness, there's a distrust of power and authority. The ability to form attachments is severely compromised by internalizing authorities as treacherous and undependable. They may need to be in control. They may feel relationships always include a power differential. It's very hard for a man in that situation to be able to somehow create a partnership in a romantic relationship, for example. Power is eroticized. And so they may get erotic feelings or expect erotic feelings when someone is being powerful, controlling them, or vice versa, they are controlling somebody else. They may maintain distance. They may be phobic about emotional attachment. One man I worked with who had very severe detachment issues had a wife, married a wife knowing that she had a disease that was almost certain to make her die relatively soon. And he said, well, I could go into the marriage because I knew I only had to maintain this intimacy for a year or two. I mean, that's a pretty horrible thing to think, to have to think. But his problem was she recovered. She did not die. And so he was kind of devastated that he was going to have to relate to this woman when he really couldn't. And that's why he was in therapy. Rage is one emotion allowed for men. And that's why we see so many men enraged. Victimization often makes a boy take on responsibility for others' feelings, as though someone has, for example, a victimizer can say, do this to make daddy happy. That's taking on responsibility for daddy's happiness. Now, in intimate and sexual relatedness, often they can't differentiate between sex and love and nurturance, affection and abuse. They all feel the same. They can't differentiate among them. And so, if you express love, that's dangerous because it could mean abuse. If you express affection, the same thing. It might mean abuse, or it might mean sex, at least, even whether you want it or not. And the other person may not want it. They just are feeling affectionate. Those of you who are familiar with Shandor Ferenczi's paper, The Confusion of Tongues Between Parent and the Child, which is in the bibliography I gave out, and it's a wonderful paper. And there's a story involved with it, which I'm not going to get into telling right now, but it created a rift with Freud. The confusion of tongues, he was talking about language. He was talking about the languages of tenderness and the language of passion. What he was saying happens in sexual abuse is that the child experiences what's about to happen as tenderness. And so he becomes more open to it. The adult is feeling passion and assumes that the child being open to what he's doing wants passion as well. So they also may learn that sexuality is a kind of interpersonal currency. And so they become seductive at times that it may not be appropriate. Say, appropriate to a female authority, a boss of some kind, when it's really not appropriate. What one man said about sex, being phobic about sex, he said, the trouble with sex is there's always someone in your face. Well, this is the same man whose wife he thought was going to die. He couldn't allow her to get that close. They may feel that sexual desire itself is abusive, or traumatic at least. Then we get sadistic and masochistic and exploitative relationships are likely in adulthood. They're hungry for contact at the same time that they are phobic about it. And they may solve it by frequent anonymous or semi-anonymous contacts while drowning simultaneously, drowning in boundaryless relationships. When that happens, they are soothing while taking care of the phobia about relatedness. So what I'm saying is, if there are frequent anonymous contacts, they feel soothed by the sex, which is not intimate. And so that takes care of the phobia about the relationship. But as soon as the act is over, he doesn't feel loved anymore. Now, of course, there are many kinds of treatment: individual, group, couple, family, medication. There are also healing techniques other than traditional professional ones. I'm sure you know about them: meditation, yoga, spiritual practices, journaling, expressive therapies like dance and art and creative writing, exercise. Exercise is a really great way to keep anxiety down. I'm sure you know this as well. Maintaining physical health, including getting enough sleep, maintaining a good diet, keeping in touch with a personal support system, helping others, altruism. It is amazing how wonderful it can be for a sexual abuse survivor to somehow get involved in an altruistic activity of some sort. Sometimes it means being involved in a group that works with survivors, or it may have nothing to do with being sexually abused, but just helping others, particularly now during the pandemic. I'm just going to say two more things. There is an organization called malesurvivor.org. Malesurvivor, one word, .org. I was one of the people who formed Male Survivor in 1995, and they have we have, I should say, a website which has a lot of information, which is great, but it also has a discussion forum, and it has private chats, which helps men who are perhaps living in very isolated places to connect to men in other parts of the world or other parts of the country. And they're anonymous. Both of them are anonymous. And yet they can make a connection. And that becomes a kind of a personal support system. So, and there are also forums for partners and loved ones. And finally, there are the books like my own, which can be very helpful to sexual abuse survivors in getting some grounding in what is going on. It is not a substitute for treatment, but it can be very helpful. And so there's my hour. Thank you.
Thank you very much, Richard, for many important ideas and insights. We have a few questions from the audience. So I'll be translating simultaneously from Hebrew. So spare with me for a second. The first question is, what can be done to raise the awareness of men regarding sharing abuse they have gone through, and in general, sharing their emotions.
Write a book about that. For one thing, I think things are much better now than they were, much better than when I first began seeing men in the 80s. There is something in the public discourse so that men know that they are, have been, that abuse is possible. And even if they don't exactly understand how it must affect other people, they do know there are other people. So one way is in therapy. I mentioned before that part of therapy is often critiquing the masculine gender stereotypes. I think this is easier for a male therapist to do than a female therapist, because a man might think that coming from a female therapist, he may think, well, what do you know about being a man? But I've known women who have been able to work it. You just have to be very careful about what you say. It's much easier for a man, because then you can say, as I have many times, well, this is something that we men do, but we don't have to. Was there more to the question, Nat?
I think it was also mentioning like the general social
okay, so the world
sphere, like the social sphere, I think.
Well, one of the things that has been amazing in the 90s and much more recently, at least in this country, is that many celebrities have come forward about having been sexually abused as boys. And some have done it in a very big way. Actors, musicians, rock stars, one politician in the US. I don't agree with his politics, but I think he was very brave to have come forward with it. And every time a movie star, for example, comes out and says, I was sexually abused, it helps other sexual abuse survivors to come forward also. And it helps everyone who hears about it think, wow, he could overcome it and have this wonderful career, or whatever it is they think about this celebrity, after sexual abuse. So maybe we need to think about it differently. And we need to think about it differently because it's coming at us all the time, at least in the US, much more frequently certainly than 20 years ago. So that's one way. And to keep it in the public discourse, to ask questions, to not be afraid to bring it up if it's appropriate to bring it up, and to speak of it in a way that is not shaming. Okay.
Thank you very much. There's another question here in English. When speaking with a client in therapy, and you suspect they have gone through sexual abuse, when or how do you approach the topic? And the person who asked the question also wanted to thank you for an extremely interesting lecture.
Thank you for that. Well, it depends. First of all, it depends on whether someone has come to you because he's been sexually abused. But you have to be careful even then. It may have been an enormous task for him to have come to you and say, I've been sexually abused, I want to talk to you about it. That doesn't mean he wants to go into details. And so you have to, when someone comes in and starts to say it all at once, I try to slow him down. I say, okay, we'll get to that. I hear what happened, or I hear that it was your brother, your mother, whoever it was. But let's talk about you first, and then we'll talk about the abuse, because I don't want him to say, to feel traumatized by telling a stranger something in the first session, and then leave and never come back. Because he might have felt I pushed him into it, or that he pushed him, anyway, that he shouldn't have done it. So I really try to develop some kind of a relationship that where they hear that I am interested in them, that I'm kind, somebody said to me recently. And then begin to ask, and I'll say maybe in the second or third session, well, are you ready to happen? Well, are you ready to tell me what happened with that teacher? And then we might go into it. Now, if it's someone who doesn't know he's been sexually abused or hasn't acknowledged it anyway, for one thing, I think it's really important to ask early about early sexual experiences. We often do that with women more now than we used to, but we need to with men as well. And you have to be careful what you say. I would not say, were you sexually abused? As I said before, they're likely to say no, and in fact, be upset that you asked. But you can say, well, let's talk about your early sexual experiences. And you have to have some prelude to that. You know, you don't just say that out of the blue, but some prelude to that. You know, what do you remember? And somewhere in there, when they're talking about their first girlfriend or whatever it is, you say, you listen to that. And then you say, were there any times that you can recall that you were touched inappropriately or sexually, ways in which you didn't like? That's a good question to ask. Not, were you sexually abused? Okay?
Thank you, Richard. I see there are quite a few questions piling up here, so we'll move to the next question. The next question is, do you reckon that there is a change nowadays in the traditional gender discourse that allows us to speak more openly about sexual abuse that has been done by women? Do you feel that you have to become apologetic when you speak about sexual abuse that was acted by a woman? And do you think that the feminist theory has any well, lack out here. Does the feminist theory has any influence on the discourse, this way or the other?
Well, let me say first of all that I think the women's movement in general has been years ahead, I should say, years ahead of the movement for men. This is about theories of femininity and masculinity, but also about sexual abuse. So people were talking about sexual abuse of women in the US in the early 80s. We didn't really talk about it until, as I said, 2002, or at least about men, I should say, until then. So there is that. And we have to thank those that started with the terrible situation of women who have been abused as girls. At the same time, I don't see why you have to be apologetic. I don't know why that would be shaming to suggest that a woman was abusive if it's clear she was. So maybe that person can clarify what we're talking about. And what else was in that question?
Let's see if they wrote in the chat. Not yet. I think that's pretty much it. That's pretty much what he was asking about. I think that at least how I see the sexual abuse discourse in Israel is that it's easier for us to speak about a sexual abuse that was acted by a man rather than one that was acted by a woman.
That's true.
I think that was what this person was asking. This is how I understood his question.
Okay, yes, and often female abusers are much more subtle and secretive about the way they abused. So they may scrub a child in the tub, in the genital area, much too much, and much too late in his life. They may comment on his sexual development in an inappropriate way. Well, almost any way is inappropriate for an adult, except in very specific situations. They may tease the boy about it. That is abusive. One mother gave her son enemas twice a week for years. He probably never needed them. And she was really raping him with that because she was a very angry woman. And if he got an erection when she was doing it, she would flick it away and told him how nasty he was. Now, you wouldn't necessarily think of someone who bathes their child too much as sexually abusive. It's hidden. But if you listen carefully, you might think of it.
Thank you, Dr. Gartner. I think that some of the questions that were asked on the chat, you actually referred to answering other questions. There is a question here from a pediatric who's asking, as a pediatric, how would you suggest to raise the possibility of sexual abuse in a medical encounter?
That's really tough. I presume that the child is in the room when he's being examined. Is that usually the case?
Yeah, and she's also asking, are there useful screening questions that you could refer to or
Well, of course, if there are abrasions that shouldn't be there, that's easy to know that you should ask something. Now, often you'll be lied to. And I think it's going to be almost impossible, unless it's very obvious, to get a parent who is abusing that child to acknowledge it. They're just going to lie. And if the child says, no, this is happening, she's going to say he's lying. But if we're talking about a teacher, for example, and the mother or the father doesn't know about it, then I think by asking, like, how did this scrape occur? Or how did I see your rectum, or whatever you're going to call it in Hebrew, it looks very sore. How did that happen? Do you remember? Might get the parent interested as well, if the parent isn't in on it already. But I have known pediatricians who said if they bring it up at all, the parent takes the child away and then he never sees them again, or she never sees them again. You still have to do your duty.
Right. Another question is, we previously in this series of lectures have spoke about somatization. And this question is wondering about the common statistics of 1 to 6 men, boys for abuse, as well as for prostate cancer.
I'm sorry, is what is the question?
It says, I wonder about the common statistics of 1 to 6 men/boys for abuse, as well as for prostate cancer. I think she's asking.
What does she wonder?
I think, yeah. I'll have to try and guess here. She's asking if you know of any statistics that connect between prostate cancer and sexual abuse in boys and men. I think that's for one. And I think that the more general question, if I hope I understand correctly, is that so we know that there's a much higher level of somatization by women in the population, in the general population. And if I understand, then the question is, are there different somatization characteristics of boys or men who are sexually abused?
Well, first of all, let me say, I think a lot of sexual abuse survivors develop advanced stage prostate cancer because they won't go to be examined. I've spoken to a number of doctors, including my own urologist, who said, "Why don't men want to come in?" When he heard what my specialty was, and actually there is a chapter in which book? It's either Understanding or Healing. Those two books are. I forget exactly which chapters are in which book. There is one that is written by a physician who was himself a survivor. And it is a guide to how to talk to men about not about sexual abuse, but the things to keep in mind if you think there might be sexual abuse going on, how to approach them, what kinds of questions to ask. And he talks about urology and dermatology, and there are a number of it. And so therefore, it might look as though there are more prostate cancer patients who are sexually abused, and so that there may be a correlation, but that doesn't mean that there is a causal. I don't think there is. I think somatization tends to be stomach pains, sometimes anal pain, sometimes pain in the urethra. But I think that women are more likely to somatize anxiety and of course this is talking in stereotypes, it's not altogether true, but they're more likely. And men are more likely to become alcoholics or drug abusers. Of course, there are plenty of women who do that too, but men are more likely to do that, or become aggressive, wind up in the prison system. I think that's a more likely path than somatization, although somatization occurs. And I think it can affect things like heart disease as well, because and blood pressure, because you're living with a secret, or you're living with something that's unresolved, whether it's secret or not. Okay.
Okay. I think we'll take a couple more questions, and then we'll finish. There's a question here regarding work with adolescents that have been sexually abused as children. Do you have any specific recommendations of working with boys or teenagers rather than adults who were sexually abused?
Well, I think the things that I said before about what the sexually abused men wanted therapists to know, those are often the things to say. You're not alone. It wasn't your fault. You don't have to say you were a victim, because that raises red flags for a lot of boys who are first coming into figuring out whether they're really male or not and developing a masculine identity at all. So you don't have to throw victim at them, but you can talk about all those other things, which those first two came to me. You can look back at the tape and see what else I said. So it's that kind of thing. And to be very kind. However, for some men, kindness is a red flag, because that is what the predator may have done in the grooming process. So you have to keep that in the back of your mind as well. Don't be too nice.
Don't be too nice?
Too nice, yes.
Mm-hmm. The person who asked a question wanted to emphasize that therapy work in the time of adolescence and in puberty can be very can make the client become very unstable, especially when they're a teenager.
Very unstable.
Unstable yes. in a generally unstable time.
That's true. Therefore, you have to be sure that you have a good relationship before you get into any of this, if you can. Now, I should say I do not work with adolescents or children. I only work with adults. So I'm speaking more from what I have heard and what I think than from my own experience.
I think my internet connection here was unstable, so I can hear a question, but hopefully I'll get back to it with the recording. For the last question, which is a more psychodynamic question, the person who asked this question wanted to ask you if you can address to the concepts introduced by Christopher Bollas about abstinence of physical connections in contrast to too much bathing by the mother.
What was the first part?
Can you address to the concepts that was
what was it besides too much bathing by the mother?
Abstinence of physical connections. Someone who was abused by a mother, who was too much physical in bathing, and became someone who's abstinent of physical connections.
Yes, I mean, that's what I said before. When someone becomes phobic about sex, for example, becomes phobic about closeness, intimacy, whether it's physical or not physical. There's a film called The Boys of St. Vincent, which is a semi-documented. It takes place, it talks about abuse in a Catholic orphanage, and it's based on true events that happened in Newfoundland. And the wonderful, there are two parts. It's very grueling, so be prepared if you're going to see it. It's in two parts. One during the years when the abuse is taking place, and one 15 years later when there's a trial. And you see how there was a wonderful metaphor that was in the film. They never stated it, but it was so clear to me. One of the men was building a house, and he kept saying, I have to put in more insulation. I'm putting in my insulation now. He needed to be insulated from his feelings. So if you're ready to be upset, you can read that. You can see that movie.
So you'd connect between difficulty in intimacy and sexual abuse amongst men. That there could be a correlation
between what?
Between difficulty in intimacy.
Yeah.
end sexual abuse?
Possibility. It's a possibility, but of course, teenagers have so much that's going on that might make them have problems in their intimate relationships. That is, it's not going to be a decisive factor if they don't get along with others, or if they, but it's something to keep in mind. You have to get a cluster of symptoms before you can go further and ask the questions of someone who is not talking about sexual abuse.
Okay, so we've exceeded a little bit of our time, but it was fascinating. Thank you so much for your time, Dr. Gartner. And I'd like to thank the audience, and I'd like to thank Hipam for the time and for the Q&A session that we had afterwards. I think we'll say goodbye at this time.
Well, it was more than a pleasure to be here. I'm very excited about being able to bring this kind of thinking to countries where no one's talking about it very much. And I suspect they're talking about it more in Israel than they are in a lot of other countries. But even so.
Well, we're trying our best.
Yeah.
And many people over the chat wanted to personally thank you. Many people over the chat wanted to
I heard you.
Thank you.
Well, I appreciate that. It's been a pleasure. So I'm going to go now.
Okay. Thank you very much, Dr. Gartner.